Hi, I'm Nick Nanton, and welcome to America's Premier Experts, the one and only place where we bring the top experts to you to help you have better health, wealth, and success. And I've got just one of those experts here with me today, Mr. Craig Lack. Craig, welcome to the show.
Thanks, Nick. Pleasure to be here. Thanks for having me.
Great to have you, man. So obviously, I know a lot about you, and you're doing some really unique things in the healthcare market, but our viewers don't. So why don't you just give our viewers just a little bit of a synopsis of what you're doing?
At ENERGI, we work with middle market companies, and we have a program we call performance-based health plans. Think of it like a business strategy blueprint for healthcare. So we identify and measure emerging risks for companies, and that creates predictability for controlling healthcare costs. We then align the interests of the insurance companies, the employers, and the employees, and we do that by incentivizing and promoting employee health. The end result is lower healthcare trend, lower healthcare costs, and greater earnings for the company, otherwise known as EBITDA for the CFOs out there.
That's great. Well, so one of the things that I think a lot of people don't think about, and I kind of learned this from you, is that healthcare is one of the largest costs any business has, right? I mean, it's a top 2 or 3 usually. Is that about right?
It is. It is. A funny little exercise I do with CFOs is I ask them, okay, finish this sentence. After payroll, healthcare is our largest, and 9 times out of 10, it's expense. Yeah, exactly.
And so, but you teach them to look at it a little bit differently as more of an investment. Talk about how you look at it.
I do. One of the things that we've identified as a result of healthcare reform, otherwise known as Obamacare,
right,
is that most of these companies look at healthcare as a liability. And the problem with looking at healthcare as a liability is you only have one metric, and that metric is price, the price of insurance. So as a result, you've got companies assign kind of a purchasing manager mentality to shopping for their insurance every year. So once a year when their rates come up, they assign the purchasing manager to go out and find insurance on sale. And so they go out and they hire brokers and consultants who also think healthcare is a liability. And we do this dance that I fondly refer to as Groundhog Day, because we've all done it every year. It's the same thing, it's the same thing. And so employers are stuck reacting to whatever rate increase they get every year, and they pretty much have 3 choices. They're going to reduce benefits, they're going to shift costs, or they're going to limit access to care. So they go to their broker consultant and they say, hey, go find us insurance on sale. And the broker consultants who think healthcare is a liability, they have 2 approaches. So this is kind of an inside look inside the tent, right? They got the carrot approach, and the carrot approach is we go to the carriers and we say, hey, if we're not going to go to the competitors, but you got to come down on your renewal. So you got to give me a negotiated renewal rate that's lower, right? Now, of course, the most obvious approach is the club. It's the most popular approach. We go to all the other carriers and we get quotes from them, and then we threaten whoever the incumbent carrier is and say, you know, if you don't play ball with us, we're going to move, right? So that's the Groundhog Day renewal process.
Every year, same thing.
Exactly. There's such a status quo to the way things have been done.
Right.
It is really hard to, create the velocity necessary to get companies to overcome that status quo. So that's why we created performance-based health plans, because what we do is we change the way employers frame the perspective on healthcare. Healthcare is really an asset, and you manage assets differently than you manage liabilities. Okay, so Peter Drucker said, if you can't measure it, you can't manage it. Right. And so when you look at healthcare as a liability, you only have the one metric. So a lot of times I like to ask disruptive questions to the CFOs. So one of those is, you're spending millions of dollars on this division called healthcare. How many other divisions do you assign an HR manager to be in charge of? Right? And that usually gets them thinking. It's like, well, I never really looked at it that way, right? Another perspective. You got computers everywhere in this place, right? Typical clients for us are 100 to 2,000 employees. So they've got literally hundreds of computers. So we ask them, what kind of a maintenance program do you have for the computers? Oh, they can tell you all about it. What about your fleet? What about your trucks? Everybody's got it, right? So then to kind of wrap it all up in a nice bow, we say, tell me about your workplace safety program, right? How do you avoid workplace injuries and accidents? And everybody's got one of those because workers' compensation is a direct cost related to accidents and injuries on the job. So they tell you, I was just in a prospect's building the other day. I walked in the front door and it's like, giant sign, 2,000 days without an accident on site, right? So when I'm talking to that CFO, I brought that up. I said, hey, tell me about your workplace safety. He's like, oh, it's fantastic, it's great, we saved all this money. So tell me about your prevention program for your employees. Oh, we don't have one of those, right? We just write a check, we give it to the carrier, and we say, hey, it's your problem, right? That's no longer going to work anymore. So healthcare reform, Obamacare, a lot of good parts, a lot of parts that aren't as good as others, right? But some of the things that it's going to allow us to do is create an attention to prevention, if you will, right? So the future of healthcare is really changing. Obamacare is changing everything. So we're really in a transition. It's probably going to take a decade, right? Because we don't do anything fast here in the U.S. So this attention to prevention is going to allow us to say, hey, healthcare historically has been always about the provider. It's always about the hospital, it's about the doctor. And we created these programs called managed care programs, which were just attempts to control the supply chain side of healthcare costs. Well, 25 years in this industry, that doesn't work. We now know that, right? So the government, another part of the government called the Centers for Disease Control, has already said in numerous studies that 50 to 75% of claims are preventable.
Wow.
But we have a healthcare system that's perversely incentivized, and physicians and hospitals only get paid to treat sickness. So we got one part of the government says most of the claims are preventable, but the whole $3 trillion medical system is incentivized to only treat sickness, and that's where the opportunity lies. So with performance-based health plans, using what's already in healthcare reform and the new Obamacare law, we're able to align these different interests. So that now, by using prevention, by promoting and incentivizing employee health, we can get employees to take responsibility, and we can make health insurance like every other insurance in America, right? You've got life insurance probably, right? I know you're a dad. You've got some kids. So life insurance, think about it. If you're a smoker, you pay more for life insurance, right? Because the odds of you dying prematurely are greater. So auto insurance, same thing. I'm a bad driver, you're a good driver, I pay more. But in health insurance, what's always existed is this unfair, unsustainable system where I could be the 6'5" employee, 350 pounds, just imagine me with 150 more pounds. Right? I'm that big guy on 5 meds with 4 different diagnoses. I pay the same premium as the receptionist who's never used the health plan. So the government now recognizes, hey, that's not working. Right? Because we have these insane renewal rate increases every year that are twice the rate of the consumer price index, right? So that's what Obamacare is all about, is saying we need to make health insurance like every other insurance, because that's the only way it's going to survive. So what we have is this huge transition where healthcare is changing from a B2B, business to business solution, to a B2C, it's business to consumer. So inside healthcare reform are all of these little nuanced changes where we're going to start to pay physicians based on the outcomes that they get for the patients. So we're changing it from this provider-focused system into a patient-focused.
That's a good thing. Well, very good. I'm sure there's a lot of people who are watching this who are going to say, you know what, I really need to pay attention to this guy. I want to find out more. How can they reach you?
Look for our book that's coming out. We've been chosen to be an author in the new Napoleon Hill Foundation book called Think and Grow Rich Today, where we were lucky enough to be selected as an author to pay homage to the original Napoleon Hill book, which is fantastic. We're going to be appearing in Inc. magazine and Fast Company, and you can always see us on our website at performancebasedhealthplans.com.
That's awesome, man. Well, congrats on those books and everything else, and I'm sure I'll be seeing you again soon.
I appreciate it.
Thanks, Craig.
Thank you, Nick.